Let's talk about the association between risk of COVID and diabetes. You know that worldwide diabetes is a huge problem. In the United States, there's more than 34 million people living with diabetes, and 1 in 5 don't even know they have it. There's also a huge population of people living with pre-diabetes. The reason this is so important is because there's a clear risk with diabetes and COVID-19. So let's talk about why you're more at risk. COVID-19 basically hijacks our immune system, and people living with insulin resistance, pre-diabetes, and diabetes have chronic low-grade inflammation or activation of the immune system. When you contract a virus like SARS-CoV-2, it increases the risk of cytokine storm, increases your risk of severe disease, hospitalization, intubation, and death from COVID-19. Controlling your blood sugars is of utmost importance right now, as these viruses appear to be now endemic in our societies. Vaccines can be helpful at reducing the risk of contracting COVID, getting severe disease, and dying, but unfortunately vaccines actually tend to be less effective in people with poorly controlled diabetes. Controlling your blood sugars helps support your innate and adaptive immune responses should you contract viruses. Not only viruses, but diabetics are at an increased risk for all types of infections, including bacterial infections. By controlling the blood sugars, you support your body's ability to fight against other pathogens in the environment. Our kids are also at risk, as we saw a 182% increase in the diagnosis of type 2 diabetes amongst our children. So once again, living in a world amongst bacteria and viruses, we need to control our blood sugars to help support our natural immunity.